Cervical spondylosis. Sore neck or stiff neck is a common problem seen among middle-aged people with sedentary office job. You can often get a painful or stiff neck if you sleep in an awkward position, work with computer for a prolonged period, strain a muscle because of bad posture. Anxiety and stress cause tension in your neck muscles, aggravate your neck problem. If the neck pain spreads to your shoulder or arm, it has already produced wear and tear of your neck bones and discs. Basic structure of neck. The cervical spine is made up of 7 bones called vertebrae. Between each of the vertebrae is a disc. The discs are made of a tough fibrous outer layer and a softer gel-like inner part. The discs act like shock absorbers and allow the spine to be flexible. Strong ligaments attach to adjacent vertebrae to give extra support and strength. Various muscles attached to the spine enable the spine to bend and move in various ways. The spinal cord, the main nerve coming from the brain, is protected by the spine. Nerves from the spinal cord come out between the vertebrae in the neck to supply the neck and arms. A pair of major blood vessels called the vertebral artery also runs alongside the vertebrae to carry blood to the rear part of the brain. What is cervical spondylosis? Cervical spondylosis is an age-related wear and tear of the bones or vertebrae and discs in the neck. To an extent, we all develop some degeneration in the vertebrae and discs as we become older. It tends to start sometime after the age of about 30. This degeneration causes wrinkles in the spine. In many people, the degeneration does not cause any symptoms. But in some people, it causes neck pain and initially the symptoms tend to come and go. Pain in the neck is the main symptom. This may spread to the shoulders and back of the head. Movement of the neck may make the pain worse. The pain sometimes spreads down an arm to a hand or fingers. This is caused by irritation of a nerve which goes to the arm from the spinal cord in the neck. The pain tends to come and go with flare-ups from time to time. You may have a flare-up of pain after unaccustomed use of your neck, or if you sprain a neck muscle or ligament. Some people develop persistent pain and neck stiffness, particularly after a night's rest. Headaches often at the back of the head just above the neck and travel over the top to the forehead. You may develop pins and needles in part of an arm or hand, caused by irritation of a spinal nerve. Some develop loss of feeling or numbness or weakness develops in a part of a hand or arm. These symptoms suggest more pressure on a nerve. This is called a cervical radiculopathy. Other symptoms are clumsiness of a hand, problems with walking, or problems with passing urine. This occurs when pressure damages the spinal cord. This is called cervical myelopathy. This is a very serious problem. Lifestyle diseases like diabetes, high cholesterol, and overweight aggravates the nerve problems. When to seek medical advice? The pain or stiffness does not improve after a few days or weeks. You cannot control the pain using ordinary painkillers. Usually diagnosed from an X-ray of the neck or from scans of the neck. Treatment include medicines, physiotherapy and in certain conditions surgery also. Prevention is better than cure. Make sure you have good posture, sit correctly, especially laptop users. Take regular breaks from your desk, from driving, or from any activity where your neck is held in the same position for a long period of time. If you often feel stressed, try relaxation techniques to help ease any tension in your neck. Avoid sleeping on your front, and make sure your head is in line with your body, not tilted to the side if you sleep on your side. Use only thin pillows to keep your head level with your body. Make sure your mattress is relatively firm. A soft mattress could mean your neck is bent while you sleep. Avoid overweight. Do regular exercise for body and neck. Control your diabetes and high cholesterol. Avoid smoking and excess use of alcohol. Avoid carrying weight on head and shoulders. Thank you for viewing.